All right, everyone who's on here right now. I can see Stephanie. The rest of you guys should be muted and also have your video off. So we're just going to figure out how to get my screen sharing. And right. Pen, can you let me know? Can you see my screen? Okay, well, that's a problem. Hey, well, we're going to be talking tonight about our newest tool. And if I click that, does it show now? Loading. Okay. All right. So here it is, straight from Hollywood. You may have seen this on some of the people covers. Kim Kardashian, Jennifer Aniston have both said that they've done this. This is the new trend. This is regenerative medicine. This is what are we calling it? It's not microneedled, micro-injected, micro-infused, regenerative healing, pushing our skin to its best. 10 years ago, when I opened the practice and I was looking at skincare modalities to bring in, the first company that impressed me with their science was Neocutis. And Neocutis was using something called peptides. In the last couple years, we've brought in a company called Plated. They're using something called exosomes, which are even more powerful at cellular communication. And now you're going to learn why we call it the mermaid facial. We are using something here with polynucleotides. So we're using salmon DNA, and we're going to talk all about why salmon DNA is so great and why injecting very superficially. So this facial term, it's a little bit of a misnomer. We are delivering these active ingredients into your skin, into the very superficial dermis, epidermis junction, and we're getting some substantial results. So we're going to have our own pictures, but we also have a lot. This is new to us from the company and people around the country and the world who've been doing this longer. So the first thing is this is a customizable treatment. So the estheticians will work with you in regards to the type of results you're hoping for. And then they concoct and bartend for you the perfect cocktail to deliver those results. So I'm going to just briefly touch on them, and then we're going to go into each in more detail as the presentation continues. But we have a specific product that is for the under eyes. And honestly, when I was working on this presentation, I was blown away by the type of results. It's an area that almost every woman, I would say at least over the age of 35, talks to me about. And we don't have a lot of good answers. So this seems pretty amazing. And from what I understand, again, better than under eye filler, which many people are just not even a good candidate for, but giving results of volume and also diminishing of concerns like darkness and puffiness. Then our second ingredient there, it's called Bostio. So that's going to be our volumizer. We're going to see this a lot for the oral area around the mouth. A lot of women over 40, we're looking at these vertical lines that develop here. So we're going to help that, but we're also going to boost our lip volume. So this could be a great product for someone who says, I can always tell when someone has their lips done. It looks really fake. I don't want that look. You're going to love how the lips look with this. And then we're into the nucleoskin. So again, this is the reason we're calling it the mermaid facial. This is our salmon DNA. And it's incredible how many things that this can do for the skin and really in how many medical uses that they have for this product. The next product is a product that I've been actually injecting for over 8 years. This is the active ingredient that we find in Sculptra, And instead of being mixed like I do for injections with sterile water, it is into a solution of a hyaluronic acid. And so it's going to be a lower percentage than what we're injecting, and it's going to be placed much less, well, it's going to be very superficial, so much less deep. Then finally, the last product is another thing that's going to work on the muscle. So similar effect of Botox here. It is the fixer product. And again, our delivery system, a lot of people in our practice have had microneedling, either the DermaPen, RejuvaPen, and now SkinPen device that we have, or our super product, the Silfirm, that's involving radio frequency. So that's delivering the needle directly into the skin. Probably nothing's being infused, but at the end, we're going to apply likely an exosome to the skin. Then we have Aqua Gold. That's been a product that stamps, but it's a solid core needle, so nothing's being delivered further. What we're using is the third one. It's this Pro Infusion. I'll let Stephanie pop in and tell you how many needles and what depths we're reaching with it.
Hi, can you hear me?
I can hear you great.
Okay, great. So yeah, we're using a little Pro Infusion tip at a 0.5 millimeter depth. So these needles actually are going directly into the skin, and then we're micro infusing these serums in. So we're not just spreading them on the surface, they're actually going into the skin at that 5.5 millimeter depth. So we know exactly what depth they're going into the skin. So that's where we're seeing these restorative and regenerative results.
And then the last needle would be what I do when I'm injecting. So we're completely deeper than where we're at here. And what they're finding is you can actually achieve phenomenal results if you can control that depth and stay superficial. So it's pretty unbelievable. I'm not sure if our video it is on my screen, so I'm just going to lift us up here so you can see this is an immediate effect after having her treatment done of improvement of the under eye coloring from this. So, low downtime to no downtime procedure with immediate effect. Who doesn't love that? Okay. So again, we're talking about the eyes. So let's call this our non-surgical bleph in a bottle. And what we can treat. So we can treat darkness, we can help with puffiness, and we can help with the lines and the crepey texture of the area. And it's doing this immediately because we're improving the blood flow to the area, we're increasing the elasticity in the skin, and we're improving the lymphatic drainage, which adds to the puffiness effect. We're doing this through the ingredients, which include hyaluronic acid. So again, that is in skincare, that is in my injectable filler. But this particular product, it is uncross-linked. So it is going to be much more adaptable into the skin. We're not going to have to worry about any nodules. We're partnering it with a lot of anti-inflammatory ingredients. So chamomile, blackberry, this isoflavonoid, which is derived from beans such as legumes, and then argireline is another peptide. So we're going to talk a lot about peptides that is, in fact, working similar to Botox. It's going to be impacting the way muscles contract in the dermis, in the skin itself. And so the appearance of the lines around the eye are also softened. Now, with our procedures, the bulk of them are going to be recommended to be done as a package where you're coming in, if not weekly, every couple weeks. And then after completing that, at least twice a year to just sort of keep up and maintain. And so you can kind of think of it with adding it on to your Botox treatment. So we'd have you do this and then you'd come in and see me for a little Botox. Okay, some more examples of what we're seeing improve under the eyes. And not just under the eyes, but you're seeing in a couple of these, I don't know if you can see my arrow, but these black arrows here in this left bottom picture demonstrate how the skin folding on the upper lid has improved for patients as well. The volumizing product, again, Arbaceo, this is really focused in the mouth area. It is for lips as well. And it's not considered a filler, even though it is hyaluronic acid. And we're seeing improvement in the hydration, the coloring, as well as the definition of the lip. So it's a combination of hyaluronic acid with the vitamin B12. And then we're seeing that it can also help with just the tissue's health in general, neural tissue, healing of the skin, and regeneration of skin cells. So again, this would be done about 4 times spaced 1 to 2 weeks. And I just want to confirm with Stephanie, are we really seeing them weekly, or do you prefer the every 2 weeks for these treatments?
Yeah, every 2 to 3 weeks is goal. 4 is okay too, but yeah, typically every 2 weeks.
Okay, so where I took this from, the one week would be a little aggressive for you to have
Yeah,
someone come back.
yeah, I think 1 week is a little too soon. I think 2 weeks is perfect just because we're at that 0.5 depth. So you do want to give the skin some time to heal.
And for our clients who are more mature, what have you heard for them in describing results around the mouth, particularly, Stephanie?
What I think is the thing that I hear is, I don't want to do fillers, but my lips are flat. So by doing the mermaid facial, they have been seeing really great improvement in just like volume in the lips, as well as a little bit of those perioral lip lines. And I can even say that, I have some lines around my lips too, and I've seen those improve with the mermaid facial.
Okay. So again, just some pictures that are not ours, but demonstrating the subtle improvement in height. And then also you can appreciate the color and texture of having hydration in the lips. And I've personally had, I say 1.5 treatments, and it was after my first treatment. I don't have an upper lip. That's genetics. I'm okay with that. But I woke up the next morning and I had an upper lip. So that was a different feeling for sure. The next product we're adding in is the fixer. So this again is the one that's mimicking how Botox works on the skin. So again, for someone who's not wanting to do traditional injections, this is certainly not a frozen injected look. This is just softening those more superficial muscles, which gives the appearance for the skin of looking flatter and less deep. So the first ingredient that's active in here is called acetyl hexapeptide, so more peptides, and it has two that are working on the muscle contractions. You're not going to get this immediately. It does take a little time, but it's going to last, a couple months. Then we have another peptide, which is called DME, and that is working on the muscle in a different way and making the skin appear more firm. And of course, then we're going back to the plants. So we got some hibiscus in here, and that's where we're getting some regeneration effect, some antioxidants, and it can also, which is surprising to me, apparently help with that muscle contraction. And then finally, again, more antioxidants from our green tea extract. So 3 to 4 treatments. We'll change that, even though it says 1 to 2 weeks, and go with Stephanie's approach, which is 2 to 3 weeks between those treatments. And again, you could be doing this quarterly with your Botox, or in replace of Botox, I should say. Then we're into rich PL. So PL standing for polylactic acid, again, the active ingredient in our injectable product, Sculptra. Again, it is combined here to stabilize it and deliver it with cross-linked hyaluronic acid, which is what we consider filler. But this is a much lower percentage of cross-link, and it is helping so those polymers are sticking around a bit longer. And so you're getting kind of a slow release stimulation on the cells of the skin. And it's also just keeping it safe so we don't have any risk here of nodulal or granular formation. It is increasing volume as well as thickening the skin. So the immediate result of having some volume in your skin is not from the PL, not from the polylactic acid. That is coming from the HA. And that's going to be there for a couple months. And that's great because as that's fading, that's when you're really getting the benefit of the PL. So that can last much longer. So we'll say, 2 to 3 years from volume derived from PLLA. For the next product, the big one, why we call it the Mermaid Facial, again, we're talking about polynucleotides. So PDRN, I'd mentioned, has been used in medical applications. So I just want to kind of go through this list so we can talk about how this isn't just created for aesthetics. This wasn't just a willy-nilly, let's make a facial weird and add salmon DNA. Salmon DNA is actually on a 4D model, incredibly similar to human DNA. And so they found that like wounds, burns, post-surgical hair restoration, um, helping in injecting it is going to help like with the Ozempic phase, as well as for people who have severe scars. If you've heard of the word keloids or someone whose scar bubbles up and just kind of takes over, this can help with that. So we're going to review a few more things on our next slide here about PDRN. So it is helping with reduction of inflammation, which is going to aid in how quickly people can heal. It's going to increase hydration substantially on its own by 90%. It's going to help diminish pigmentation in the skin because it's regulating our melanocytes. It's going to help the skin. Oh, we're going to have to go a little faster here, but we're close to the end. So it's going to help the skin communicate. It's going to help by stimulating those cells, which for, again, us women over 40, they're just not doing much. So we need to wake them up. And it's very safe because, again, of its combination of similarity between salmon and human DNA. So we're not seeing much issues. And it's also protecting you from UV damage. And then again, with that communication, it's talking to the blood vessels of the skin that make the things like collagen and also the blood vessels to improve the cellular food delivery of oxygen and other nutrients. So, in the product that we use in the Mermaid Facial that has the PDRN, it's called the Nucleoskin. And it's got 2% of the salmon DNA, plus, just like we had it in the rich PL, we've got that cross-linked hyaluronic acid in there. And then we have a little glutathione. So that's helping with that skin brightening from it. So we're getting some lifting, some tightening for anywhere we apply it. So this can be used on the face or body. And again, 90% immediate increase in hydration. So 3 to 8 weeks, you're seeing mostly the effect, just like we did with the rich PL, of that HA volume, the hyaluronic acid volume, until that PDRN starts taking effect and stimulating the skin to make the collagen. So just like with the rich PL, we can see results that last up to 2 years. So we would like to see everyone add on a CO2 lift mask at the end of their Mermaid facial booster. So this gelatinous substance that's applied to the skin that you've seen peeled off. So after about 5 minutes, it's going to be in place in this jelly consistency. But what this does is it's using science. So there is a science equation called the Bohr effect, which talks about how carbon dioxide shifts and we're getting this oxygen infusion into the area. We're improving circulation. We're going to get toxins out. And so after one treatment, and this is the only thing we did to you in our office, we can increase your hydration 117%, your elasticity by almost 30%, decrease the wrinkles, pigment by 30%, and increase re-epithelialization by 100%. So hyperbaric therapy, which again utilizes CO2, that's been used for almost 100 years, and they've used it medically to help with ulcers, healing, and reducing inflammation. So we just want to do a little video, and I'm going to let Stephanie just kind of talk about what the experience will be for the patient, and then I'll click the video.
Yeah, so we are going to apply numbing cream to the skin for about 15 to 20 minutes. So that way the treatment is nice and comfortable, but we're just going to then be stamping. So we start with under eyes, we go on to the lips, and then we'll do full face. So forehead and cheeks, nose, lips, chin.
Okay, so I'm gonna hope this will play for the audience. Are you seeing it play?
Yes.
Okay, good. So pretty quick. I mean, I don't think this video is that sped up.
Mm-mm. Yeah, so we're going to apply it about 3 passes per area.
Okay. And you could see just that little bit of bleeding. Are they gonna walk out and see any bleeding?
Yeah, you'll have a little pinpoint bleeding afterwards, but that's where the mask really helps with that. So the mask kind of heals all the little micro channels. So that way, it reduces the inflammation. You don't have to worry about bacteria getting in the skin. So it really is that CO2 lift mask at the end that closes everything, seals everything off, and reduces a lot of that like pinpoint bleeding and inflammation.
So do you think they could go out to dinner with friends that night, or would you recommend a night at home?
Oh no, you could absolutely go out afterwards. Your skin's gonna be super glowy. It looks great. No one will be able to tell that you had anything done.
If someone had an event, when would you time them doing a mermaid facial from their event?
I mean, I saw my results start around 3 weeks. That's when I was like, oh, my skin looks really, really well, or really, really good. And then I think it was that like 6 week mark that we have that the photos, my before and afters, is when my results were phenomenal. So yes, the sooner the better for an event. But if you want, if you can only get one in before an event, 3 weeks, I think is a good sweet spot. 2 to 3 weeks.
But there will be some immediate change. Like I noticed my lips look better the next day. So, I would say it's worth doing if we can get you in and you have something in the next couple of days, you could still get benefits from better looking skin.
Mhm.
Okay, so just seeing some more improvement here with this is the mask by itself. So you can see in those top images with the circles where we have the lines on the cheek and how by hydrating and filling that in, the skin looks firmer and better. And you're seeing in the second row of photos that someone's had some laser treatment like we do in our office, and then to calm the skin down this CO2 mask was applied, and then 45 minutes later, that's how much redness had been reduced from post-procedure. So that's pretty incredible. And then I gotta move my photos here again. So for the last photo, again, we're seeing how immediately after the effect of the CO2 was in calming the skin. Okay. This is mermaid facial and post photos. So the one on the left would be immediately post. We were just, kind of talking about like what you're going to walk out looking like. The middle set of photos is one treatment 12 hours later. So as I was saying, you could still do this and have an event in 48 hours and feel like, well, I look better. And, when you do injections, I always say you're probably, with toxin, you're at least a week before you're going to notice any change. And with filler, well, you've got some swelling in the first couple of days, so it just depends on what you're willing to tolerate there. Last photo on the right is, more substantial results because, we've got an older client who has more substantial concerns, but we're also seeing from a month what we've been able to do with some of that stimulation of the skin with our biostimulators. Now, this is a client of ours. So she has had 2 treatments. Stephanie might be the one who did her treatments. And can you talk, Stephanie, where are we in from before and after? How far apart was this?
This is actually Peng's client.
Okay.
So this was taken after 2 treatments. So she spaced her treatments by 2 weeks. So this would be a before and after 4 weeks.
Okay. So this is 4 weeks after her second treatment.
No, 4 weeks from start to finish. So 2 weeks after her second treatment.
Okay, so we're really just seeing, like we were just showing in that last picture, from a month from her first facial, and we're seeing what I appreciate on the right photos is there's almost like a lift to the cheek. It looks more sculpted. The lines derived from the nose down appear softer. The under eye looks lighter. It looks like there's some more volume there. And this is, again, the start for her at 60 of those results. We're just getting a little closer here for you to focus in on how that darkness and under eye hollow, that's improved. That's a beautiful result, in my opinion. Oh, who is this person? All right, Stephanie, let's talk about your protocol in doing your three treatments, how you space them, and how far out we are with these photos.
Yeah. So my second treatment was 2 weeks after, and then my third treatment was 3 weeks after. So
Okay.
this is a before and after, a total that then would be 5 weeks.
So 5 weeks from your first one, but only like a week out from your third one?
Um, so then we took these actually, these were 3 weeks then after my third treatment. So sorry. So this would be actually 8 weeks results. A little
Okay,
less,
so
it was like a little under 8 weeks.
okay, so 8 weeks from your first treatment. So you're really
Mhm.
now seeing the effects of the bioregeneration, maybe from your first treatment. So you're just going to continue to see better results for another couple months. And I cannot tell this audience how many times in the last week to 2 weeks we've had people stopping Stephanie and saying how snatched she looks. What did you do to your skin? I want what you're having. So these results are not touched up. These are actual results of Stephanie. And I mean, I actually didn't see him until I was putting this picture together and I get to see Stephanie a lot. So I had